I literally just got from the hospital.
Like, it feels like something constricting your blood just in a certain area.
As a kid, I was in the hospital every month for a week straight. What's up? We got Kyle in the building.
What's up, everyone?
This is our introduction video, semi-introduction video to sickle cell. There's gonna be a part 2 that goes into detail about privileged pilots. But yeah, we in Houma right now. My boy Kyle has some business hand out here. Tell him what you gotta do out here.
Yes, sir. So we're gonna be doing some UAS work. If you don't know what UAS is, that's unmanned aerial system. That's unmanned aerial system.
All right, he out here on a business trip. Luckily, I work in Houma. I'm a truck driver. My job is based out in Houma. So when he said he's in Houma, I'm like, yo, that's perfect. I gotta be to work in 3 hours, but we could still shoot some footage. So we out here, and yeah, I literally just got from the hospital, but I'm like, look, my boy out here, we gotta make it work.
Yes, sir. I appreciate you for having me out here, Daniel.
Yeah.
You know, he had to give me that permission slip.
yeah. I ain't gonna lie, we been supposed to link up back in September, but then I went to the hospital. I'm telling you, I'll be getting out the hospital, but I ain't gonna lie.
Yeah.
As of late. No. But yeah, we supposed to meet up in September for the podcast, the OBAP podcast. He's out in Atlanta, and the podcast is shot in Atlanta. And I literally went to the hospital the weekend that I was supposed to go there. I ain't gonna lie, I was a little mad, but I think everything happened for a reason, because whenever, we are on the podcast, we'll have a lot more things in place, like this video, as well as website, more clothes, a lot of more things to showcase. So yeah, but let's get started with a little introduction about yourself. So like I said, Kyle, say your name and occupation, and we start from there.
All right, so my name is Kyle Registry. Currently my occupation is UAS operations with Phoenix Air Unmanned. So I kind of just make sure that UAS operations are going safely and efficiently for utility work. We do a lot of power line inspections, oil and gas inspections, surveying, aerial surveys. So that's kind of what I do.
Okay. And where are you from?
I'm from Marietta, Georgia.
Marietta, Georgia. How far is that from Atlanta?
Maybe 20-30 minutes.
Oh, okay. So like right
there. So Metro Atlanta.
Metro Atlanta.
Yeah,
okay,
Metro Atlanta.
If you told me in Marietta, I'm like, I don't know what you're talking about.
Yeah, Metro Atlanta.
Okay.
Typically, people just say Atlanta, but
yeah. So how old are you?
I'm 23 years old.
23. Okay. And a little background on me, guys. I am Daniel. I'm a truck driver who's pursuing a career as a pilot, and I'm from New Orleans, Louisiana, and I'm 21 years old. So the main focus of this video is to kind of give more information on sickle cell, directly coming from sickle cell patients. We've been living with sickle cell our whole life, but he's been cured with gene therapy. We're gonna get deeper into that later on in the video or in the next video. Let's start off with you. So what is sickle cell to you?
So sickle cell disease to me, it's an inherited blood disorder. So my mom had the sickle cell trait, my dad had the sickle cell trait, together, trait then becomes the disease. Well, I should say when 2 people have the trait, you have a 25% chance of passing on the disease, 50% chance of passing on just the trait, and a 25% chance of just passing on nothing, neither the trait nor the disease. So I was at 25%, I got the disease. And essentially what sickle cell does is it prevents your red blood cells from carrying the oxygen required for your body to function, to different organs, wherever your blood flows, just prevents those red blood cells from transporting that oxygen like it should, and it causes pain crises.
Yeah, and I believe, if I'm not mistaken, the reason for that pain crisis is because your cells become misshaped, and cells are very small. Like any cell is very small, but especially a blood cell. And with sickle cell, it's a crescent shape, and also creates less oxygen. So there's 2 problems. One, if your doing a very physical activity, a very intense activity where your muscles are being used a lot, your blood has to flow to those muscles to carry out oxygen to these muscles. And, you know, if your blood simply isn't carrying much oxygen as a normal human being, then it's going to cause pain whenever you're exerting yourself physically. But another thing is even the shape of the cell, like it being a crescent shape, it's more prone to clotting because it's so small. It's extremely small that once you feel that clot, like that pain is like, the way I describe a pain crisis to somebody, if they ask me, what does a sickle cell pain crisis feel like? I'll tell them it kind of feels like, so like let's say you're having a pain crisis in like your arm or something. I say it feels like a rubber band, an extremely tight rubber band around your arm. Like think of it the tightest rubber band ever. Think of it on 10 and think of it like going in and out, like pulsating. That's how a sickle cell crisis feels to me. And it could be in your arm, it can be in your chest, your stomach, it could be anywhere. Yep. And how would you describe a sickle cell crisis?
I would kind of say, you know, you did a good job of describing it. You know, it feels like, to me, sometimes the pain is just kind of a dull, throbbing pain.
Yeah.
You know, like Daniel was saying, like it feels like something constricting your blood just in a certain area. Like if it's your arm, you know, if it's around your upper arm, that pain is going to travel down throughout your lower arm and your hand. So it's not just going to be where that rubber band is tied off at, but it's going to feel like it's your whole arm.
Dude,
you know?
And in my most recent crisis, this happens with most crises, depending on how long I go without it being treated. But my most recent one, it started off like in my back, and then it spread to my chest, and then it spread to my arm, and then the thing with a sickle cell crisis, oftentimes it'll spread if you don't do anything about it.
Right.
Like if you don't go to the hospital or take proper medication, it spreads. And the scariest part for me is when it starts spreading towards my neck.
All right.
Dude, like sometimes I never, God forbid, never had a stroke before. Mm-hmm. But whenever I start feeling it in this area, I'm like, only thing I can think about is a stroke. Yeah. I'm like, nah, yeah. I cannot. Because the stroke can lead to permanent damage.
Right.
Or death.
Yeah.
So yeah, that's how a sickle cell crisis feel.
I know sometimes, you know, once you go in the hospital, you know, just like Daniel was saying, as sickle cell crisis spreads, or sometimes you'll go in the hospital with pain in one area, and just from getting all the fluids and everything, and the sickle cells just traveling around your body, you may encounter an acute chest syndrome, and you know, that's another scary thing about having sickle cell disease.
Yeah, and I could go on a whole tangent about that, but I don't want to make this video an hour-long video. So, but real quick before we move on to the next topic, so with sickle cell, a lot of the times they ask me, so like, what's the treatment for it? Like the treatment as in like, you know, immediate treatment. And I'm like, the only thing you could do, like if I go to the hospital, only thing I tell them is Dilaudid, morphine, like basic pain medication, and IV fluids. Right. It's like when you get a sickle cell crisis, there's not much you can do about it. Now, granted, you know, at some extent, like whenever it's extremely severe and like nothing's being resolved, you got the transfusion. Right. Whenever a crisis come along, it's really just a matter of letting time pass. And the only time you really don't feel pain is honestly when you're asleep. Right. So it's like that medication they give you really puts you to sleep typically, and that helps. So to kind of wrap this up, what are common misconceptions about sickle cell? Or what do you especially desire that people know about sickle cell? Start off with you.
All right. Well, common misconceptions about sickle cell disease is that, you know, we fake pain, or that we're typically, you know, drug seekers, you know, especially as you get older. You know, when you're younger, you know, you're not looking at little kids and saying, oh, these guys are coming into the hospital just to get on drugs or whatever. But as you get older, you know, common misconception is that we're not really in pain. We're just going to the hospital for pain medication, which is totally untrue. It's just that with sickle cell, growing up with sickle cell, you've developed this pain tolerance, and typically, you know, as you get older, you know, it's not seen, you know, as masculine to be shedding tears, you know, while you have a pain crisis. So, you know, we might not be crying, but our pain is at an 8, you know, and that's admittable pain right there. So, I think that's a big misconception. Or like even, you know, back when I was in high school, you know, I may not come in and, you know, people may be like, oh, you just want to miss school or whatever. Well, that's not true. I'm in a pain crisis. And because my outer appearance looks like I'm not in pain, doesn't mean I'm not in pain. I mean,
Yes.
Daniel's in a pain crisis right now.
I'm
Can
in
you
pain
tell?
right now.
Can you tell?
I'm in pain right now, but it's like you grew up with sickle cell your whole life, and then you've been through worse. Like in September, it was extremely bad. So this is bad, but it's nothing compared to what I've been through.
Exactly.
So
exactly.
You know,
so you build up that pain tolerance and you push on through. You know, at the end of the day, we gotta live our lives too.
Yeah, man. The misconceptions. Where do I start? Honestly, the biggest misconception is. Let me start off with this statement before I say that. So sickle cell affects everybody differently. That is the biggest misconception. Like, the statement I just made is true, but people don't understand that. People think sickle cell, black or white. They don't think of it as a spectrum. Right. You know, like there's other illnesses that has a spectrum, like autism. There's a spectrum. It affects your body differently, and there, like you said, you know, growing up with sickle cell, you said as a kid it was kind of okay,
right? And
then
as
you got older, it got worse.
Right.
I'm the inverse. As a kid, I was in the hospital every month for a week straight. Like, the amount of school that I missed is ridiculous. Luckily, I was a competent child, so missing school didn't set me back grades or years or anything. But that's the biggest misconception, and trying to explain that to like people, especially officials like the FAA. I'm gonna hold off on that. I'm gonna hold off on that tangent. You can't get it through people's skull. They have their opinion on sickle cell. They have what they think is true on sickle cell. They think that if I have sickle cell, I'm just this disabled black child who's incapable of doing anything, and it's simply not true. It's like I'm a very self-aware person. I'm aware of what my limitations are. I'm aware of what affects me. I'm aware of how to cope with it. Like when I was in 10th grade, you know, I was becoming very conscious of life, but especially my health. And in 10th grade, I stopped eating chips, and then I stopped consuming sugar as frequently. Now, I'm not saying I'm perfect and I never ate chips or sugar in the past 5-6 years, but I made a very mental decision, conscious decision, to stop consuming these things as much as I did, or at all. And I did that because my doctor said, you know, you have sickle cell, you know, you definitely want to keep a healthy diet. And, you know, I did my own research on that, and I'm like, let me try it. And doing those things, like not living that unhealthy, typical American lifestyle, really helped me not have pain crisis. I went from, what year was this? I went from 2018, April, to 2022, December, no crisis.
And that's a big deal.
Yeah.
That's a big deal right there.
4 years with no crisis, and that was as a result of a lifestyle change. You know, I was also on hydroxyurea, but I was on hydroxyurea prior to 2018.
Right.
But in 2018, that's when I made that conscious decision to stop consuming things, live a healthier lifestyle outside of medication. And it really helps. Like, there's ways to make living with sickle cell better. And I want people to understand that. Like, that's one misconception. So, any final thoughts before we go on to the next topic?
No final thoughts or anything. There's so many other discussions we could have, but this video will be hours long. Like
our first phone call was 2.5 hours, bro.
Right. There's just so much to discuss. I mean, we haven't even gotten into the different types of sickle cell out there, you know. Yeah, and you know, like there's gonna be a lot of content. As you can see, we're in like the introduction phase, and like I can go on for days. So to wrap this up, you know, me and Kyle met today for the first time and wanted to make a video directly from sickle cell patients on what sickle cell is, how it affects us,
because there's a lot of misconceptions about sickle cell. Now, as it relates to privileged pilots, as you can see, we will create a separate video where we kind of go into depth on, our experience as student pilots, pursuing aviation as a career, and like kind of how we formed. So we'll see y'all in the next one. It'll be same setting. So I'll see y'all.
Stay tuned.
Stay tuned.